Hello, this is Dr. Shurpaneni. The topic for today is hypertension or high blood pressure. Essential hypertension is basically the most commonly diagnosed high blood pressure condition among the average adult population in the United States. Essential hypertension refers to hypertension that's not secondary to underlying organ dysfunction. This is basically a problem with higher pressures in your arteries. Higher blood pressures in our body are a result of increased peripheral vascular resistance. When I say peripheral vascular resistance, I'm referring to arterioles, which are these tiny little branches that come off the arteries, mostly made of smooth muscle, which are responsible for the elasticity of these arterioles. Your heart is responsible for pumping blood into the arteries and arterioles. We call that cardiac output. Over time, arterioles become more calcified due to overstimulation of the smooth muscles, due to contraction of these smooth muscles, due to certain mechanisms, which we'll talk about later, results in calcification, ultimately stiffening of these arterioles and higher blood pressures. The latest definition of high blood pressure or stage 1 hypertension is now categorized as systolic blood pressure between 130 to 139 and diastolic between 80 to 89. When you're over 140/90, it's categorized as stage 2 hypertension. The Joint National Commission 8 guidelines, which is the latest guidelines for management of high blood pressure, defines the category of patients for managing blood pressure goals include the younger population, which is defined as age under 60, and the older population, age over 60, and patients who have organ issues like diabetes, chronic kidney disease. We'll talk about treatments later. There's a clear linear relationship between rising blood pressures and complications like cerebral strokes and heart attacks. One of the processes that could be responsible for stimulating the smooth muscles in the arterioles include sympathetic system as part of the autonomic nervous system, which can worsen or increase constriction of the arterioles, ultimately raising the peripheral vascular resistance and your blood pressures. This is tied into your mood, physical activity, and stress levels. The other system that's responsible for raising blood pressures includes renin-angiotensin system. Your kidneys are able to produce a hormone called renin, which is part of the endocrine activity of your kidneys, which ultimately results in production of angiotensin II, which is responsible for vasoconstriction or narrowing of your blood vessels, raising your blood pressures. Also, angiotensin II results in increased production of aldosterone, which is also responsible for increased vasoconstriction of the blood vessels, along with reabsorption of sodium, chloride, and stimulation of the posterior pituitary gland. It's important to recognize that the renin-angiotensin system is activated when your kidneys sense a deficit in salt levels in your bloodstream, and also when you're dehydrated, which results in production of renin and then the domino effect of eventually producing angiotensin II. Although we clearly understand that renin-induced angiotensin II and aldosterone levels can increase blood pressures, this association is not commonly found in patients with essential hypertension, more notably in elderly population and African Americans. Therefore, medications that can block the renin-angiotensin system does not play a significant role. The blood vessel can be really broken down into three layers: the outer elastic membrane, the middle smooth muscle, and the inner endothelium. Endothelium is just a thin cellular structure which is really responsible for producing hormones that can dilate and constrict your blood vessel. Damage to the endothelium due to trauma, higher pressures, results in an imbalance between the vasodilatory hormones like nitric oxide and vasoconstrictive hormones like endothelin. This imbalance eventually leads to higher blood pressures. Salt or sodium chloride, which is often associated with higher blood pressures. We have a well-established relationship between salt and rising blood pressures. Salt is responsible for retention of fluid, and our human bodies only require 500 milligrams of salt, but when there's excess amount of salt in your body tends to retain volume of fluid. Salt or sodium chloride is responsible for water retention. As a consequence, increasing your blood volumes and resulting in increased blood pressures. We only require about 500 milligrams of sodium intake, and any excess amount of salt results in edema, increased blood volumes, and hypertension. Studies clearly show excess consumption of salt over a long period results in damage to the blood vessels and eventually organ damage, especially to the kidneys, which are responsible for processing salt and fluid. JNC 8 basically has pointed out differential goals for blood pressure control based on the patient's age, their medical risk factors, and race. For instance, if you're a patient under age 60 and are relatively healthy, then your goal for blood pressure control is only when your blood pressures are about 140/90. If you're age 60 and above, then your goal for blood pressure control is only when your blood pressures are about 150/90. Now, if you follow that algorithm and add medical risk factors like diabetes, chronic kidney disease, then it doesn't matter what age you are, your goal for blood pressure control is when your blood pressures are greater than 140/90. One other important point I want to make about blood pressure management is to recognize the race of the patient. If your patient is Black, you have to understand that the patient's blood pressure treatment choices should be initially limited to thiazide or calcium channel blockers, because renin-angiotensin system does not play a significant role in causing their higher blood pressures. Therefore, they don't respond well to medications like ACE or ARBs. Again, ACE inhibitors like lisinopril or ARBs like losartan should be reserved for non-Black population as one of the first-line choices. In the non-Black population, you can choose one of the medications like calcium channel blockers, thiazide diuretics, ACE or ARB medications. Some treatment choices for controlling high blood pressure include diuretics like hydrochlorothiazide, angiotensin receptor blockers like losartan, ACE inhibitors like lisinopril, beta blockers like metoprolol tartrate, calcium channel blockers like nifedipine, amlodipine, vasodilators like centrally acting agents like clonidine. A general strategy to help manage blood pressures is to identify ongoing complications, relate to a person's age, race, and any other genetic components that could be dictating their elevated blood pressures. Initially, you want to start off with one drug and try to maximize the drug before you start a second drug. Or add a second drug without maximizing the first drug. The last strategy could be start patients on combination medications Situational management of our patients based on the clinical risk factors is recommended. So for instance, a patient who has heart failure, they need to be on blood pressure medications that also have a mortality benefit, like angiotensin converting enzyme inhibitors like lisinopril, angiotensin receptor blockers like losartan, diuretics like spironolactone, beta blockers like metoprolol. These medications, again, are important to be used in patients who have coronary disease or who have had heart attacks, diabetes, chronic kidney disease. Chronic kidney disease especially will benefit from starting on an ACE inhibitor or an ARB. And if a patient has had a stroke, ACE and diuretics are recommended. In pregnant patients, we can choose beta blockers like labetalol, calcium channel blockers like nifedipine, or central agents like methyldopa. Side effects with blood pressure medications are important to recognize. Let's talk about ACE inhibitors like lisinopril. ACE enzyme is responsible for converting angiotensin 1 to angiotensin 2, which ultimately results in increased blood pressures. Now, by blocking this enzyme, we reduce blood pressures. Unfortunately, ACE is also responsible for degradation of a molecule called bradykinin. And when bradykinin accumulates, some patients can develop a chronic persistent cough. Now, this cough can manifest immediately or could also be a delayed onset. So essentially, an alternative medication like angiotensin receptor blocker, which only blocks the angiotensin 2 molecule, can bypass this ACE pathway and therefore does not have a persistent cough associated with it. Thiazide diuretics like hydrochlorothiazide can cause side effects like hyperglycemia, increase your uric acid levels, drop your sodium levels, including potassium and magnesium, and while increasing your calcium levels. Diuretics like spironolactone can increase your potassium levels because they spare potassium and can also cause complications like gynecomastia. Beta blockers like metoprolol can drop your heart rate, making you dizzy, lightheaded, can interfere with hypoglycemia, exacerbate hypoglycemia, and sometimes can also cause fatigue. Calcium channel blockers like amlodipine is responsible for pedal edema or foot swelling. Other calcium channel blockers like cardizem or diltiazem, which is a heart rate slowing drug which also affects your blood pressures, can result in increased release of protein in your urine, and while also making you bradycardic or slow heart rate, making you feel dizzy. Blood pressure medications like hydralazine, which are responsible for blocking alpha receptors on the blood vessels, cause reflexive tachycardia due to unopposed action on the beta receptors on your heart. Other medications like clonidine, which can decrease your sex drive. It's important to take control over your blood pressure management. Cut out bad habits like smoking. Make sure you're eating a low sodium diet, which is less than 2 grams per day. You're consuming alcohol only occasionally, limiting to less than 2 to 3 drinks per week. Have been exercising 3 times a week. following up with your physician to make sure that you're compliant with your blood pressure control, going through screening for other conditions like diabetes, chronic kidney disease. With the advent of technology, smartphones, wearable smart devices, we're now able to detect higher blood pressures more accurately and also understand patterns in a patient who is suffering from high blood pressure by looking at the data on a continuous basis. Being informed about blood pressure medications and blood pressure control can help you prevent disability from a stroke or even death from strokes and heart attacks.